Hi, how are you?
Hi, how are you?
I'm good, thank you. My name is Srusty. I'm from Atlanta, Georgia, in America, and I am a part-time tutor on Cambly. And my class usually practice talking, but if you have any reading material you want to review, I'm also open to that. So, do you want to introduce yourself?
Okay, my name is Abdias and I talk from São Paulo, Brazil.
Mm-hmm.
And I'm very new about talking English.
Okay.
How do
Uh-huh.
you um how do you use do the classes?
So usually I just whatever is based on the student's request. So if you want to practice talking, like your conversation skills, that's okay. Like we can talk about random things, but if you want to focus on reading and grammar more, then I also have articles I can suggest. If you want to read them together, it's fine as well.
I
Mhm.
I, I like focus on grammar.
Grammar. Okay. So do you want like an article you want to read? Um,
No, no, actually no.
No? Okay. Okay, that's fine. So do you just want to practice talking today?
Maybe,
Okay.
maybe.
Okay, no problem. Okay, so like are you a student right now? Do you work? What is your occupation?
Yes, I work as IT assistant, but I'm on my
Mm.
vacation. Actually,
Okay.
I will go back to the work on Wednesday.
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 Oh, okay. There isn't a lockdown in Brazil still?
Yeah, it's a lockdown here in Brazil,
Mm-hmm.
and it's really crazy here right now
Mm-hmm.
because some of people want to go to the work again because our president says that the economy can't stop right now,
Yeah.
but the the majors and
Mm-hmm.
go state government says that now we have to stay at home to flat the curve
Mm-hmm.
of the virus.
Mm-hmm. Mm-hmm. So what is your
But
opinion? Mm-hmm.
what? Just
Uh, what is your opinion on the matter?
now I prefer to be at home. If
Mm-hmm.
you if you are if you don't work with essential services,
Mm-hmm.
you have to be at work. But I have a lot of conversations about this here with some friends of mine,
Okay.
and I guess that Brazilian people always have a lot of expectations about the government.
Mm-hmm.
We are the we are people that we are very passive passive people,
Mm-hmm.
and we should we should try to be something about ourselves.
Mm-hmm.
Help someone that's close to you
Mm-hmm.
is a way to overcome about it.
Yeah. Uh-huh. Yeah, that's good. Hmm. But like, the issue here, like in America, it's the same. The government is like the national government, they want to continue their regular function in America because of the economy. They don't want the economy to go into a recession. But local authorities, they have to suffer with the consequences of the virus. Like the hospitals are flooded with patients. There's not enough staff at the hospital, not enough doctors and nurses to treat the patients, which is very unfortunate. But so just like how it is in Brazil, the situation, I feel like it's similar here, but a lot worse because we have a lot of infected individuals now. We have, I think, 160,000 today. And that's a big number, Like, I understand that America, they in some areas they have like a nice healthcare system, but in some parts there's still not enough like hospitals or medical supplies to accommodate this large patient volume, you know. Yeah.
I guess is the same here.
Hmm.
Brazil is a very, very big country, you
Hmm.
know, and some regions of the country is so, how can I say, don't have the resources to take care about health or engineer or all the
Technology.
things,
Uh-huh.
technology. And another places is totally different.
Hmm.
And right now there's some place that the virus is not so increased.
Hmm.
And but if we if we if we are not on the lockdown right now, uh, all the hospitals will be
But
how can I
it'll
say,
be like overflowing with patients.
yes, we don't have a lot, we don't have space to take care of about the total of people who will go into the public service. And in all the cases,
Hmm.
it don't matter if you have money to go to the public hospital
Hmm.
or if you have money to go to the particular hospital,
Hmm.
private hospital. And our president don't care about it.
Yeah.
They and they say to people go to the work,
Hmm.
and his minister
Hmm.
of health
Hmm.
say the opposite.
Yeah. Hmm. It's the same
And
situation here. Yeah.
we are very confused. But right now they say that when you have some problem with health,
Hmm.
the state governments is the authority
Hmm.
about the case. So we are at home yet,
Hmm.
but it's it's still confused.
Confusing. Yeah, that is very confusing. Like, and they're also trying to come up with like a treatment, but there's so many research labs and so many like government funded programs that are helping to come up with the resources of like finding a treatment. But I feel like it's bad for the poor, whoever is, falling below the poverty line, that they're unable to access this treatment because a lot in America, healthcare system is not free. You have to pay for medication and everything, right? Even like a doctor's visit, you have to pay for. And a lot of people have to pay for getting tested for the coronavirus itself. So that like demotivates them to go and get tested if they do have symptoms, which is it's sad because that's why I feel like America has been hit with this virus the most out of all the other countries in the world, because of its healthcare system. It's not sufficient for the poor in the country. And even if we come up with a vaccine or a treatment, I feel like a lot of people will not have access to the medication because of the price and how expensive it will be eventually. Mm.
Is that in the US some effective treatment?
Yes, so they did find that like starting, I think in a couple of days, they're going to do clinical trials on anti-malarial drugs. Like I don't know if you've heard of hydroxychloroquine. It's
Yeah.
Yeah, so it's given to patients with malaria, but in some cases of coronavirus, it has shown that it fights off the pneumonia, the severe symptoms in the lungs, and like the breathing treatment. So it's helping to reduce those severe symptoms in some of the patients. Yeah.
That's the same treatment that we use here in Brazil, and now the state have to control it because people were going to the drugstore and sold out it.
Yeah.
And there were people that use it to treat malaria, to treat another disease that is specific from some region of here, of Brazil, and they were finding on the drugstore because people were buying to treat the corona.
Yeah. And there's also like several other names, like I forgot, it starts with an A. They're also doing research because corona is like a very fast mutating virus. So there are multiple strains of the virus, so you need a specific drug to combat a specific strain also. That's why if one drug is not effective, then they use another drug to treat the different strain. Yeah. So like they're using another medication that treats like HIV/AIDS patients because whoever has a weaker immune system, they're more affected by the coronavirus. So there's this drug that helps to boost your immune system so that they can fight off the virus much faster. Yeah, but
here in Brazil is a war of the information. Some the media great media says a thing to be opposed to what the government says, and I guess that's kind of thing make me be scared.
Yeah.
Because almost no one in Brazil have heard about the treatment of patients that get cured about corona. But I guess that it's gonna be, how can I say, we will solve this problem sooner than we think.
Yeah, I hope so.
I hope so.
I hope so because like I feel like the numbers, I mean, flattening the curve is very important because I feel like the numbers exponentially grow of how many infected is because of people are not practicing social distancing. But once they start doing that, it should, I hope we can solve this problem as soon as possible for sure. Yeah. I'm
Yeah.
actually a medical student, so I do go to the hospital every day, but it would just be more convenient if people just stayed inside, in my opinion. Especially young people, those that aren't severely affected by this virus, then they wouldn't spread it to like the older generation. Yeah.
Okay, thank you.
No
I'm
problem.
glad to have this conversation with you.
Me as well. Have a good day. It was nice meeting you, and stay safe. Okay.
Thank you.
Bye.
Bye.